You've also announced the increased social welfare measures, which includes relief for the people living on or below the poverty line. How are you monitoring this? There's also questions being raised about abuse of the system. Of course, it's tax dollars. It has to be monitored well. But at the same time, we need to protect those who are vulnerable. What type of work is expected to go into it, into the new budget?
Vijay, that's again an important issue. So we increased the social welfare allowances when we came in first in 2023-2024 budget, together with other measures such as back to school and price support for other sectors of the economy to raise people's income. But for social welfare, you're right, there is an element of abuse, and we are saying to our people, please do not prey on government services on social welfare if you are not one of those that is not entitled to. We want to make sure that we provide those targeted supports. There are a number of schemes within the social welfare category, a disability allowance, family income support, social pension. There are a number of other measures there. And we are very pleased that we've been able to increase all those across the board by about 5%, given other measures that we are putting in place in terms of addressing cost of living, addressing the issue of VAT reduction, maintaining the 22 basic food items, including prescribed medicine, zero VAT. We are saying that the increase that we've given to the social welfare recipients in 2023-2024 budget, given the inflation rate, this 5% increase is going to go a long way to further supporting those vulnerable groups. But the Ministry of Social Welfare is also working on addressing the loopholes on the abuse. And our message is very clear as a government: do not abuse the system. Let people who deserve that get the benefit, and that will allow government in the future to increase this further. If we save those abuse, that can all go to the people who deserve more.
The HIV epidemic is a major concern. We haven't had comprehensive awareness campaigns for a number of years. It was seen that it had become a real threat by the time the coalition government came in, and the hard realities were facing us right from the beginning, where we could see the level of hard drug use, and now the number of new cases with HIV confirmed cases showing direct link to injectable drugs. You have announced a 10 million package to fight HIV/AIDS. It's quite a historic number. Prior to this, at times in some budgets, it's only $100,000 to $150,000 for the whole year. If you can explain the big step that you've taken.
So, Vijay, again, let me say this, that these are very good examples: the HIV, AIDS, drug, crime, the interconnectivity of these three issues and the social issues that it has created. And these things, like many others that we inherited, do not come overnight, do not happen within 1 or 2 years. This is a result of years of neglect on drug issue, on NCDs, on HIV, on crime, and this is a government that has taken this head on. We have not been afraid of putting out the statistics, putting out the data. Whenever any study is done, whether it's on health, whether it's on education, this information is out in the public, out to media organizations like yourselves, who do a good job to put out the issues that are there. And we recognize this from the assessment that was done earlier, that this is now a serious issue. People are dying.